Hello and welcome back to another skills check video. Me and my patient Jonah here. We're going to show you a little bit about some skills in the lumbar spine and check some special tests there. So first we're going to start off. My name is Kalani and I am a student physical therapist at Midwestern. So first we're going to check, before I forget, the posterior anterior glide of the vertebrae in the lumbar spine, L3, L4, and L5. And I'm just going to be showing you grade 4 because you know the rest. So, how are you doing today?
So good.
So good. All right. Can I have you roll to your belly?
To my belly?
Yes, I would like to roll to your belly. You can put your face in this too. And in order to properly assess the joints, I'm gonna need to pull your shirt up. Is that okay?
Yeah, I guess.
Okay.
I'm married though, so don't get any ideas.
Okay. So, I'm going to find L3 right here. I'm just gonna move all the way through. You let me know how you feel through all of them. Just give them a little test first. L3, L4, L5 doesn't really have a lot of movement. Just because it's right on top of that sacrum. Right on top of your, what we call the butt bone sometimes. All the way, grade 4. How are you feeling?
Your hand kind of hurts, but that's all.
My hand hurts?
Yeah.
Okay, how's that?
A little better.
A little better? Good. And L5, no significant mobility deficits. You go through all the way, and they're kind of springy, so that's good. Okay, next we're gonna do a side-lying passive lumbar flexion test. And just a disclaimer, I've tried this on multiple different people and I've always struggled with it just because I can't get the table low enough, I feel like. And my body mechanics, my arms just like don't go around. So just a disclaimer, but I'm gonna do my best. All right, so Jonah, if I could have you lay on your right side for me, facing me. Perfect. You can scoot towards me just a little bit. Perfect. That's a little too far. There you go. All right, I'm just gonna find L3, L4, L5. All right, so you cannot help me move your legs. This is passive.
Okay.
Does that make sense?
Yes.
All right. So I'm just gonna get up under there. I'm gonna lift, feel it at L5 to L4, and L3, and then back. Passive motion. Feels pretty good. You doing okay?
Doing super okay.
All right.
You've got nice arms.
Thank you. Okay, now we're gonna do a prone instability test, and this is typically for patients who have anterior hip pain or they have like feelings of instability or like popping and clicking sometimes. So we'll get to it. All right, Jonah. So now what I'm gonna have you do is I'm gonna have you just lift this leg up to 90 degrees, just like that, okay? And now you're just gonna keep it really loose for me. So again, like it's passive like the last one, so I'm gonna do the moving. I'm gonna find the greater trochanter. You feel okay with this?
Yep.
Okay. And I'm just gonna externally rotate the hip. Any pain?
No.
So this would be a negative test, and if it were a positive test, we would find anterior hip pain or pain in the front of the hip. So you're good with that, Jonah. All right, now we're gonna be showing you the sacral compression and distraction tests. So we're gonna start with the distraction test since our patient is already lying down. So indications for these tests if our patient has lumbar pain with mobility deficits, and yeah. So what we're gonna have Jonah do is he's gonna lay on his back. Okay, lay on your back. And if you could, you know your two hip bones right here? If you could find them for me. me grab my stool. Perfect. Okay, so what I'm gonna do is I'm gonna press outward, and I just want you to tell me how you're feeling, or if you have any symptoms or pain that you came in with today. It should be familiar.
Okay.
Make sense? Okay. Is it okay if I press down right there on those bones? Right here. Okay. Deep breath. Anything there?
No, it just feels like you're pressing on my bones.
Okay. Perfect. No pain is a good thing. Okay, now we're gonna do the compression test. Again, this one is also indicated for patients who have low back pain with mobility deficits and low back pain with movement coordination impairments. So, what I'm gonna have him do is I'm gonna have him just go on his side, facing that way. Just like that. You can bend these knees for me. Alright. And I'm going to be pressing on that hip bone again, okay?
Okay.
I just want you to tell me if you have any pain or symptoms that you came in with today. Let me find it. Anything?
Oh, that hurts a little.
Hurts a little? Is it familiar?
No.
No. Where do you feel it?
Where you're pressing.
Okay. Bones are a little tender, so that would make a little sense. But none in the back part of you?
Oh, no.
Okay. So that would also be a negative test. A positive test would be if he had reproduction of symptoms. Okay, now we're going to be doing the slump test, and that's usually indicated for patients who come in with lumbar radiculopathy or numbness and tingling down the legs. So what we're gonna have Jonah do first is he's gonna sit up tall with his arms behind his back. We're gonna have his legs close together, okay? And with his head forward, we'll have him just bend over around here. Perfect. Legs close together. And now pop your head down. All right. And which side did you say was bothering you today?
My right side.
Your right side. So we'll start on the uninvolved side first. So your left side. So you're just gonna extend. Any symptoms here?
Real tight hammies.
Tight hammies, okay. But nothing numbness or tingling like you said? Okay, perfect. And I'm just gonna pop your foot up. Anything there? Maintaining that flexion?
Nope.
Nope, okay. All right, now we'll try it on the right side. You can rest in between. Take a deep breath. Okay, now we're gonna go down again. Pop your head down. Adduct your legs together. We'll bring them together. And then lift this leg. Lift it. Any pain? Any symptoms?
No symptoms.
No symptoms. And if you had symptoms, I would move your head up only, just 2 joints away, just kind of assessing that joint. But since you are clear, you have a negative slump test. Positive would be recreating those symptoms of radiculopathy.